The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hi, welcome to the latest episode of Mental Health Now. I'm your host, Matthew Shapiro from the National Alliance on Mental Illness New York State, or NAMI-New State. And today we're going to be talking about one of the issues that's of paramount importance to all people impacted by mental health issues, and that's accessing services and the role that insurance parity plays in making sure people access services or proper mental health services. So I'm so honored to be joined by two experts on this issue. We have Andrew Malekoff and Tracie Gardner, and we'll talk about what organizations they're from in a bit. But I'm going to start with kind of giving a background about the insurance issue and parity issue, because it's so important. So, Tracie, you're with the Legal Action Center, and this year they're heading the Parity at 10 campaign here in New York State. So we're celebrating the 10th anniversary of the Paul Wellstone, Pete Dominacci Mental Health Parity and Addiction Equity Act of 2008. It's a bit of a mouthful, and I think it's important to note, we actually just recently lost Senator Dominici, who was so important in getting this measure passed. Of course, he was a senator from New Mexico. His son had schizophrenia, so he saw how families were having these difficulties accessing services and introduced the bill. So can you talk a little bit about the bill and what that led to?
Well, as you know, Legal Action Center, we're a law and policy organization, and we work on health issues, addiction, criminal justice, the intersections. And so their Legal Action Center has an office in New York, but we also have a national office. And so this was a major priority for us to have this piece of legislation passed to address mental health and addiction issues. It was very important as well to have it address both issues of the brain and kind of push back against the stigma around both, and then to have it incorporated into federal health care reform, into the ACA, was a major victory. It certainly opened up and made a kind of embrace of the fact that issues like mental illness and addiction are as essential to address as health conditions of the body. And so there was a coalition, a kind of unprecedented coalition of behavioral health national organizations that worked together to ensure that parity would be placed within healthcare reform. So, as you know, it doesn't demand that insurance provides for mental health and addiction coverage, but if the plan does, then it has to provide it at parity with other health conditions. And I work with a lot of experts who've looked at this issue very deeply, and but it mostly makes sense to me as a person who is in recovery and who has definitely used services, and there's such a deep stigma around these issues. It's almost as though you're made to feel that you're undeserving, that asking for services for addiction or mental illness, you're supposed to be treated shoddily, or you're supposed to get only partial care. And the Parity Act really pushes back on that and says it's a whole person. So, this is a big deal for us. I don't know if you want me to talk about Parity at 10 now, or...
Sure, and of course, we say it all the time, and you've touched on something, we say it all the time, that you can't have health without mental health.
Correct.
It's something that is so obvious to us. I think it's not quite as obvious to insurance plans, and we're going to get into that. But yeah, so tell us a little bit about what the Parity at 10 campaign is talking about.
Well, it's really highlighting the 10th year of the existence of the Parity Act from when it was a standalone piece of legislation, and really calling attention to this law that is very underutilized around the country. A lot of it has to do with, it's a very complex law, and it depends a lot on a certain level of expertise in terms of being able to identify when the law is being broken. So in New York, we're very fortunate. We've had Timothy's Law. More recently, we've had Parity extend to substance use disorders because of the opiate epidemic. And
we've also had Attorney General Schneiderman suing private insurance companies for not.
So there's definitely, there have definitely been violations, but really the challenge or the goal of Parity at 10 is to really make the law workable and usable, especially for the directly affected families, directly affected individuals, providers. It just is something that really needs to be better utilized, and there's a role for state regulators to play, and there's a big education role that a lot of people just don't know that the Parity law exists, or they don't know when they're denied to appeal or to even invoke that it might be a Parity violation. So we're really trying to raise the level of awareness. I will say, as one issue in particular, we feel very strongly that plans should, on their own, make sure that they're complying with the Parity law, the federal Parity law, as well as the state Parity law, and that it shouldn't be on parents or families or individuals or providers to prove that something is in parity. So there's something called prospective review, and that would mean that the state regulators would say to the plans, show us how you're going to have your coverage at parity. And so it puts the onus on the plans, and it helps our state officials hold the plans to the law.
Right. So to discuss this really has become a giant problem. People are having a terrible time accessing services, and we're so lucky to have Andrew Malekoff from the North Shore Child and Family Guidance Center in Long Island join us today, because they've put out this fantastic, very in-depth report called Project Access, which kind of accumulated a year-long study where they interviewed over 600 people about their experiences and frustrations trying to find help. Can you talk a little bit about the study and what you found, Andrew?
Yeah, I'd like to thank you for for inviting me to be a part of this. I think it's such an important discussion, and in listening to what Tracie had to say, I think a very important part of this being the 10-year anniversary, and you mentioned Paul Wellstone and Pete Domenici, is that one was an arch Republican and the other was an arch Democrat, and the two of them came together. And when we think about the divisive kind of situation that we're living in right now, which does nothing to help anyone's mental health, it's certainly a welcome reminder of where we need to get to. And so, in terms of...
we say it all the time. Mental health issues, I think when people advocate, they're so worried we can only talk to one party about these issues. But, with 1 in 4 families impacted by mental illness, it impacts so many people that you never know where, and again, like I said with Senator Domenici, even though he was a staunch conservative and Paul Wellstone was as liberal as it could be, it was because his son had mental illness, and he's a family member, and you never know, those experiences. So I'm sorry.
And Trace, and I'll get to your question, but bouncing off what Tracie said about stigma and the shame that it generates, it's such a critical barrier to getting help. So when you're dealing with that, and then you finally get to the point where you're willing to pick up the phone and ask for either help for yourself or for a loved one, and then the phone gets slammed down on you because the providers won't accept the insurance,
Right.
that's a really big issue and a real concern. So it's been a concern for me and for our organization, North Shore Child and Family Guidance Center, for many years. Now, fortunately, we turn no one away for inability to pay. So providing universal access is, one of our hallmarks, and including triage and emergency services where we make a rapid response. But at the same time, I've been concerned for many years about that not being the reality for most people that need help. And, there's a story that really brings this to life for me, considering the context that for the last 10 years, since the New York State Department, the Office of Mental Health has really concentrated on restructuring the way they finance, for example, outpatient mental health agencies. There's been a laser focus on Medicaid and Medicaid managed care. And the story, it's a true story. Some years ago, I live in Long Beach, which is on the beach, and I was in the ocean, and someone pointed out to me very quickly that there was this, looked like a bunch of kids that were drifting towards the jetty, which is a big rock formation. And I looked, and sure enough, there were 3 little girls hugging each other and drifting out, and apparently the lifeguards didn't see them. And I swam out as fast as I could. I'm not a great swimmer, but I got to them with the adrenaline. I put my arms around them, and within a short period of time, the lifeguards came, and they helped, and then I, was able to swim to shore at that point. So imagine this. Imagine if I swam out to those 3 little girls, and instead of embracing them, if I treaded water about 3 or 4 feet away, and I said, "Hey girls, do you have Medicaid?" And if they said, "No, mister," and then I swam away and back to the shore. And that's the situation that we're in New York State, and I'm sure beyond that at this point in time. So I've been speaking and writing op-eds and going to hearings and speaking to legislators for a number of years, and I really felt I wasn't getting anywhere in terms of the issue of access. So I wrote a proposal and got funding through the Long Island Unitarian Universalist Fund of the Long Island Community Foundation. And it was to do a study. We put a group together of providers and consumers, parents, advocates, not all mental health people. It was a mix. And we, with the help of LIU Post, who are research partners, we got IRB approval, so it was official research for human subjects. And we surveyed almost 650 people and, essentially asked them a number of questions about the ease or difficulty with which they experienced getting to mental health or addictions, substance use disorder care. And what we found, which didn't surprise me at all, and this was a population of people who were already getting care because we went to the licensed clinics, throughout the area. We also put it online. About 40% of the people that responded said that it was there were not enough providers in their insurance network. Almost 50% said it was harder for them to access mental health or addictions care than other medical care. 2/3 said that their insurance company did not help them. About 40% said that stigma and affordability were critical issues for them, and so on and so forth. And so
And one of the things too that in reading the report that is shocking to me that it could take. Some people said it took up to 15 calls to doctors to find ones. Now again. When you're in a crisis, or you have a family member in a crisis, it's the thought of having to try to call 15 people and get rejected 14 times before you get it's unthinkable.
And that's why we don't know the people who are not getting care. Did they go out of network? Did they forego care altogether? And so to put it in a nutshell, with all of this, the question is, okay, you put a report out like this, and so what do you ask for? 10 things, 20 things you could, or one thing. And the one thing that we said is that because the issue here is network adequacy, which is a part of parity. It's the part. There's two parts of parity. There's the part of once you get in care, are you able to get what you need in terms of paying a fair copay, deductible, having the number of visits you need? But then there's the non-quantitative part, which is before you get in, how do you get in the door in the first place?
Right.
And that's the network adequacy part of it. And that's a part that I think people don't know that much about. And you mentioned, Attorney General Schneiderman, who has done the prosecution of a number of these companies, but he's not responsible for network adequacy. The Department of Financial Services in New York State is responsible. So the one thing we asked for in this report was for them to launch a full investigation of network adequacy, and we have a Republican and a Democrat, Senators Kaminsky and Senator Kaminsky and Senator Phillips, who have signed on to this, wrote a letter to the Department of Financial Services, and also confronted them at a health budget hearing in which Commissioner Vullo said on recorded video recording that, to the effect that we understand and agree that this is an issue and we will do something about it. So now we want them to do something about that.
And it's interesting. It's so well known. At the mental hygiene budget hearings a couple of weeks ago, OMH Commissioner Sullivan, who's been a guest on the show, said you're much more likely to get better mental health services through Medicaid than you are through private insurances. And I told you guys before we started, I have a story not to that severity, but it just shows the problem that I get mental health services here in the capital region that actually is a very good provider. I'm not going to mention them, but it's interesting. So, I have ADHD, so I get my medication from one side of the building, the medical doctor, and I said, I've been having some issues, some family issues, and I wanted to do some talk therapy. Is there someone in the practice I can talk to? So they sent me to the other side of the office where the talk therapists are, and I handed them my insurance, and we have pretty good insurance. And they said, well, out of the 8 counselors that we have, only one of them takes that insurance. So here we are, we're under the same roof. I'm getting half my services on one side and they take the insurance. Go to the other side and it's so hard to access the services. And then, since it's only one person, they didn't have an appointment till 6 weeks out. Now, again, luckily I wasn't in crisis. I wasn't someone who, was desperate, who needed to see someone right away. I was able to wait the 6 weeks. But again, if someone is in crisis or is having a really tough time, this could be a life or death decision if they're not accessing the services.
And I think it's important to unpack, and especially for people who aren't familiar with the parity law or even this idea of network adequacy, which is the obscenity of being faced with 8 providers, all capable, but only one that accepts the insurance that you have. Why is that? The insurance rates, what the provider is reimbursed, is so low for mental health related issues that providers have to make the decision or choose not to engage.
Including a disparity between Medicaid and commercial insurance.
Exactly. And that really needs to kind of be brought home. It's not that providers are saying they don't want to deal with the issue with your health. They simply are not being compensated in a way that makes sense, in a way that makes them viable. And that is a insidious part of the stigma.
Right. Now, as part of the problem, now, if I went to, you go to your general practitioner or whatever, and, in an hour time, a general practitioner maybe can see 3 or 4 patients, where in that same hour, someone who's giving psychiatric services will only see 1 patient. So, on one hand, you have the physical side that can bill, 4 times in an hour, and the other side bill 1 time. Is that a bit part of the problem, why we're seeing these issues?
Well, I'm sure Andrew could speak more capably to it, but this this is the comparability issue, right? So it has to be a comparison of like and like. And so to the extent that a session with a therapist that is half an hour, 45 minutes, is equivalent to a 15 to 20 minute with your primary care physician. It seems like that could be more comparable, or that there is an acknowledgement made that there needs to be more time, especially if you're talking about talk therapy, psychopharmaceuticals. It requires a certain level of time. I mean, I don't know, Andrew, what do you think?
No, I think there has to be some sort of equation that that would be fair. But it's, the equation is not fair right now. I mean, I recently had to go to an ENT, and they put one of these endoscopes. It was like, and then they looked in my ear. The whole thing was 3 minutes. Right. And then I looked at the bill from the insurance company. It was $600 for the endoscope, right, and it was another $250 for the ear. Right. Now somehow, 45 minutes of an intervention for someone who may be suicidal, yes, who is dealing with tremendous anxiety, is worth more than $50. When you
absolutely,
compare it. And another, so the other part of it, I think, it's enforcement is a part of it. Compliance, it's compliance and enforcement, and the compliance part of it, it's on these insurance companies. It's the greed of the insurance companies that keep those reimbursement rates as low as they are. And we tried at North Shore Child and Family Guidance Center to reimburse, to negotiate better reimbursable rates with one of the companies a couple of years ago. We couldn't even get them on the phone. We're not renegotiating rates. I called corporate headquarters and I said, I would like a list and contact number, names of your board of directors. They said, oh, we don't know if we have that. And I said, well, you must have it. This is your company. And so they said, someone will call you back. A vice president called me back and said, what do you want? Why are you calling for this? Why do you want it? I said, because you will not renegotiate rates. And so when we tell everyone that we see, which is a lot of people, that they can no longer come here, and they asked us why not, I want to give them the names and phone numbers and addresses of the people, your board of directors, who can answer that question. Right. And quickly he said, okay, we'll negotiate with you. Right. And so it shouldn't take that.
Threats. And there's a lot of we have a lot of concerns about practices by insurance companies being a barrier to care. One of the other big issues is medication issues. Now, obviously, not everyone needs medication who's in psychiatric recovery, but for those who do, we want to make sure they get the medication their doctors think are most appropriate for them. But what a lot of people don't know, too, there's what they call non-medical formulary switching of drugs. So you can sign your contract at the beginning of the year with the insurance company, and mid-contract, they could switch what drugs they cover. So this is a practice it's dangerous. I mean, psychotic drugs, antidepressant drugs aren't interchangeable, and I think it's very deceitful to consumers too. When you're signing if I signed a contract with you to deliver services, and halfway through the contract, we don't deliver those services anymore, it's deceitful, and we do have
also prior authorization. And I'm not. I mean, in the addiction world, and given the opiate epidemic that's going on, there are 3 FDA-approved medications, and so one of the initiatives that the governor put forward is to remove prior authorization for these life-saving drugs. I have been told by colleagues working in the mental health field that is also a barrier that can be life or death.
Sure. Yeah. So we've obviously detailed how deep this problem is, but we do have some solutions.
Yes, we do.
Like to leave a bit of a positive note. So I want to talk a little bit what families and individuals can do, and what we can do with law. So very quickly, we have about 5 minutes left. So the Legal Action Center in 2016 put out this Parity guide and tells people what to do if you're running into these challenges. So can you talk about that a little bit?
It is thorough. This was done by one of our amazing Parity experts, Carla Lopez, and it really walks you through the kind of complexity of the law, but it's speaking to you as primarily the consumer, and kind of how you can even look out for red flags of what may or may not be a parity violation. So it's an amazing amazing resource, and it is as accessible as it can be for the complexity of the law. But if you go to our website, www.lac.org, and go to resources and go to Parity, you'll also see some one-pagers that give you an overview of things like, high differential and high coinsurance or differential deductible levels. So as Andrew talked about, there's some that are quantitative that you can count, and some more that are more like treatment limitations. So that is downloadable. All of our materials are downloadable, and we're just trying to get the word out, and there can't be enough education about this.
So for both of you, what advice would you give to people who are running into these issues? They can't seem to find services, or the services they find aren't being covered. What can people do about this?
Well, I think from the perspective of getting in the door in the first place, the issue of there being an adequate number of providers, if someone runs into that problem, they should call the New York State Department of Financial Services. And if you just go on their website, NYS DFS, you'll find out who to contact. I mean, I think this is a fantastic resource that Tracie just described, and I just think also how sad it is that people have to play cat and mouse games with the insurance industry. But also, if you want to go to www.northshorechildguidance.org, on the top of the menu it says Project Access, and you can go there for the full report, and also a letter that's formatted that you can put your information on directly to Governor Cuomo if you're having difficulty getting access to care or other parity issues for that matter.
The only thing I would add to what Andrew said in terms of calling DFS is, when in doubt, say, I think it might be a parity violation. Because part of the problem is when people complain or they're denied an appeal, then that gets addressed, and so it's not seen as a parity issue. It's not counted as one. So in order to create the awareness and also help the regulators see that this is in fact a problem, I don't think there are no parity violations in New York. We need people to kind of just look at these guides and say, it might be a parity violation that I'm dealing with.
Right. It's interesting. On our last episode, we talked a lot about advocacy, and we kind of touched about the role stigma is playing. And we had 3 young adults tell their stories, and it's amazing how they're not just advocating for better services, but they're advocating for themselves. And we really, NAMI New York State's committed, and we hope the show gives people the tools to advocate for themselves, advocate for services, and advocate to improve the system. And one improvement that we're really looking to do is we're asking both the Assembly and the Senate to add $1.5 million in the one House budget bills to fund a behavioral health ombudsman to monitor mental health violations through the Department of Finance. So this would be a positive step in the right direction. I know we talked before, there's also a parity bill there that we're looking into too. So hopefully there'll be some hope on the horizon on this issue, because we want to eliminate all barriers to treatment. That's really our primary mission here at NAMI New York State and on the Mental Health Now show. So I want to thank you both so much for what you're doing, for raising these issues, for giving the people the resources to empower themselves and get the care that they need and deserve. As we say all the time here on Mental Health Now, hope starts with you. And thank you so much for what you're doing, and thank you so much for watching. And again, the resources will be, you can go to the NAMI New York State website, www.NAMI-NYS.org, to access these. And thank you for watching.